Would you like for the Greater Hickory Metro to learn more about you and your business? You can do that with the First Talk Business Brief, a 4-minute extended advertisement for your business any Monday through Thursday morning on First Talk with Hal Rowe. The First Talk Business Brief is a paid commercial advertisement and is available to advertisers of 1290 WHKY. Contact your account representative for more information. We hope you enjoy this First Talk Business Brief.
Good morning. Welcome back to First Talk with Hal Rowe on 1290 WHKY Talk Radio for the Greater Hickory Metro. We want to welcome our new clients, Frye Regional Medical Center. Dr. Jim Cook starts us off with our first business brief of the year. He's a bariatric surgeon and also medical director of the surgical weight loss program at Frye. If you want more information on this, call 877-251-3429. We're going to talk this morning about an upcoming seminar that happens January 19th at 6:30. And Dr. Cook, good to see you again, sir.
Thank you, Hal.
And now, you reminded me that we were here 10 years ago when this actually kind of started out at Frye. And I'll be honest with you, I'd forgotten about that. But now that I see you and recognize you, I remember that now, sir.
Right. It was about 10 years ago. We started our program in 2001, and perhaps it was 2002 where we came and my program director at that time, Joyce Vale, was with me, and we came and spent some time with you one morning, sort of like this.
I want to find out, first of all, a little bit about you and your area of specialty. You're a surgeon, but tell me about your area of specialty and how you got kind of into this area, sir.
Right. Well, I'm a general surgeon, but bariatric or weight loss surgery is a subspecialty of general surgery. Okay. I originally trained at the University of Kentucky back in the early 80s, and we had a very strong weight loss surgery program there. And then several years ago at Frye Regional, the opportunity came about where we could establish a weight loss program at Frye. So we started the program in 2001. Now
you're head of the program there, and are you the one who does all the surgeries? Do you have different docs or doctors doing different surgeries?
No, I'm the medical director. That means that the buck stops with me, so to speak. But we actually have two other surgeons, Dr. Monty Cox and Dr. John Hotta, who are bariatric surgeons with specific training in that area as well.
Tell me about the seminar that's coming up. Of course, it's going to be happening the 19th. It's going to be over, I believe, at the Park Inn, if I have that correct. Now, tell me a little bit about what we're going to learn and what we're going to find out there, because I don't know a whole lot, but I do know this. There are certain cases that are appropriate for weight loss surgery, and there are certain cases that may not be. So tell me what's going to happen at the seminar and who should attend.
Right. We have quarterly seminars here in Hickory, but we have seminars around the western part of North Carolina, and these are general information seminars designed to answer basic questions for potential patients, family members, medical providers, anyone really who has an interest in this field. It's designed to help patients make a decision as to, are they candidates for this? Is it something they might be interested in? What are the things that have to be done to become a surgical candidate for one of these operations?
Right.
And really anyone is welcome to attend who has any interest whatsoever. We occasionally have students who come. So we have all kinds of people from different interests who come.
Generally, give me an idea of who may be, if you could do this, who may be a good candidate. Is it somebody who has tried over and over again to lose weight and it's just not been successful? Does it have to start at an early age? I mean, you've been big all your life. Is it someone who just maybe recently had a tremendous spurt of weight gain? Tell me, if you would, someone who has the potential of saying, okay, this is a really good candidate. Well, it could be anybody. But let's talk about maybe somebody who's listening this morning who's not been successful with weight loss for whatever reason.
Well, first off, obesity might be the biggest medical problem facing our country these
That's what
days.
I've heard, yeah.
So now, weight loss operations are not for everybody who has a weight problem. Generally, when a person's BMI is 40, then we start to seriously talk about a weight loss procedure.
Now, a BMI is body mass index, is that right?
Body mass index. That's
Okay.
a measure of a person's size, which takes into account height and weight.
Okay.
And it's a pretty good measurement. Most of the insurance companies and the government and that kind of thing use that standard to basically measure a person.
And we can find this information, if I'm not mistaken, on the internet, or we can go to our physician and get a general idea of our BMI.
Generally, when you go to your family physician, your weight is recorded, but your BMI is also recorded.
Okay, good.
And on any number of websites, you can simply plug in your height and weight, and you can calculate your BMI quite easily.
So BMI over 40.
Right.
Okay.
And it's true that patients should have made serious attempts at weight loss in the past.
Okay.
A weight loss operation is not what we consider the first option.
Okay.
In fact, there are people who are successful, with weight loss programs other than surgical programs.
Right.
But the problem is, the more overweight you become, the less likely you are to succeed with a non-surgical type weight loss program.
Right.
So BMI 40, past attempts at weight loss, and then these days we do a fair amount of education prior to the procedure, so that reduces the risk of potential problems and also optimizes outcomes.
Yeah, you want to have a successful outcome with this, and that's the thing. If you're going to do this, my understanding is you got to be committed. You got to want to do it. If in the past things have not worked out for you, and you want to get into it and you want to do it, it will take some effort. It's by no means a quick fix. It can help you, but it's by no means a quick fix. Let's talk a little bit about Frye, and help me with the Centers of Excellence. There's been an award or designation that Frye has received as a center or Centers of Excellence.
Right. In many areas of medicine these days, special designations are made which recognize specific training, preparations in the hospital in terms of equipment, for example.
Okay.
So we doctors who are involved with the program have special advanced training in this particular area. We have a whole program devoted to this subspecialty. A Center of Excellence designation means that our program has been reviewed in terms of how many patients have we done, what are the results.
Okay.
An inspection has been done in our hospital to specifically look at our equipment.
Gotcha.
Do we have the equipment and the capability to take care of larger people?
Now, so what I understand is that you have, at Frye Regional, you have, I don't know if it's a wing, a floor, but a certain area that is dedicated specifically for this. Is that correct? Do I have my information right there?
So we have special operating rooms.
Okay.
We have a unit in the hospital where our patients go post-operatively.
Okay.
We have nurses who are experienced and specifically trained to take care of patients who have weight loss operations. So there is some there are specific requirements that go into this to take care of these patients.
Now, you also have on staff, you've got, of course, the pre-op people who work with you. You go in, you talk to the docs. You got the people who are going to help them after the surgery, but also dietitians, and even a psychiatrist, somebody who can help with the mental aspects of this. Because I'm thinking that this is something that either the being a big person, being a large person, or having that weight loss could have issues associated with that as well. So you all make sure that everyone's taken care of from the time that they meet with somebody until the very final follow-up. You're going to make sure that that total health picture comes into play and the patients are taken care of.
Well, one of the things that we try to stress right from the beginning is this is not just an operation.
Okay.
It's an entire program devoted to making changes in a person's life that they've tried to make for a long time.
Right.
The operation helps with that,
Okay.
but by no means is it just an operation. It's a lifelong commitment to change in order to avoid health problems and improve a person's general health and longevity.
We've only got 1 minute left, and I know that we didn't review this, we didn't talk about this, but I do want to ask you one question, and if you could, in 1 minute, sir, give me an example of somebody that you may have met, or somebody that you talked to, or somebody who's gone through the program that you've seen really a life-changing situation where you said to yourself, yeah, this is the good stuff. This makes me feel good. I'm glad that I'm doing this. And I know a minute is not enough time, but maybe an example that you could tell us about.
Well, it's hard to think of one because I probably have those kind of situations several times a week.
Really? That's great.
So, specifically, I can think of little things. I can tell you people who come back and tell me that, I can tie my shoes now.
Yeah.
I can take my kids to Carowinds and get on the rides with them. I can go to a restaurant and fit into a booth.
That's all the good stuff.
I don't have to shop in the big and tall part of the store.
I'm just telling you from personal experience, the style's just not there like it is in some of the areas. Dr. Cook, I want to thank you very much for joining us. You got a seminar coming up. It's going to happen January 19th, 6:30, Park Inn. That's here in Hickory. We'll have other ones coming up in the area. And you're going to be kind enough to come back one morning and just talk about weight loss surgery in a general area. We'll find out more about that.
That's right.
Thank you so much for joining us, especially on this cold, rainy morning.
Thank you, Hal. Good to see you again.
Good to see you, and thank you again for joining us.
You have been listening to this morning's First Talk Business Brief. The First Talk Business Brief is a paid commercial advertisement offered to advertisers of 1290 WHKY and is a great opportunity to more fully promote your products, services, and/or events. Contact your account representative for more information. We hope you enjoyed this First Talk Business Brief.
Hip to Hickory, Mandy Pitt's on the way next year on the First Talk radio program.